Phentermine and Qsymia are both medications used for weight loss. Phentermine is only approved for short-term usage, while Qsymia is approved for long-term use. Topiramate is a medication used to treat seizures and prevent migraines. It also happens to have a noticeable weight loss effect, although it's not approved in Canada solely for treating obesity. But how do they work? And how do their weight loss effects compare to each other? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. In this video series, we'll compare various medications that cause weight loss in people. Please subscribe for more videos about weight loss medication. Let's compare the three drugs, Phentermine, Topiramate, and Qsymia, for their effects on weight loss. Full disclosure, the medications we talk about here are not all available in Canada. The information presented here is a combination of research, experience from non-Canadian clinicians, as well as my own experience with some of my patients taking these medications. Phentermine, which goes under many trade names like Adipex or Lamaria, is officially approved for only short-term use by the FDA for weight loss, around 3 months, although it's frequently taken for longer. Topiramate, which also goes under many trade names like Topamax or Trokendi, is a medication used officially for treating seizures, epilepsies, and migraines. Qsymia is approved for long-term use, like over 6 to 12 months. Qsymia is actually a combination of both Phentermine and Topiramate, so there will be some similarities between Qsymia and the other two. So in this video, I'll do my best to focus on the differences between all three drugs. We have specific videos on Qsymia and Phentermine each, so check them out if you want more in-depth information on either of them. I'll leave their links down below in the description. Side effect comparison. Phentermine is a stimulant and is commonly associated with insomnia, nervousness, and heart palpitations. Topiramate is kind of the opposite and is frequently associated with drowsiness and fatigue. Phentermine is more associated with cardiovascular side effects like heart palpitations or rapid heart rate, while Topiramate is more associated with neurological side effects like dizziness, confusion, mood changes, or muscle coordination issues. They both have gastrointestinal side effects like nausea or abdominal pain, and may also change the taste of your food, making it taste strange or different. Both should also be avoided during pregnancy. In Qsymia, the stimulant effect of Phentermine is somewhat counteracted by the drowsiness effect of Topiramate, although people can still end up potentially experiencing the side effects of taking both Phentermine and Topiramate. Regardless, you should be properly screened and regularly assessed by your clinician while on any of these drugs, since they can all potentially cause serious medical issues if taken inappropriately. How they work. Phentermine works as an appetite suppressant. Amphetamine-like stimulants like Phentermine often suppress appetite by stimulating the sympathetic nervous system, also known as the fight or flight nervous system. Normally, this system is activated during times of acute stress and prepares your body for fight or flight by getting your muscles ready to act. It also shuts down unnecessary systems in your body like your digestive system. A side effect of this shutdown is a suppression in appetite. Topiramate also works as an appetite suppressant, although its exact mechanism of action is not really well known. Qsymia combines the best of both worlds, so to speak, by combining the effects of both Phentermine and Topiramate to create appetite suppression, while minimizing the dose of each to reduce as many side effects as possible. Approved uses and availability. Only Topiramate is available in Canada at the moment, specifically for the treatment of epilepsy and migraines. Phentermine and Qsymia are not legally available for prescription in Canada, so online pharmacies that claim to sell them to Canadians are not doing so legally or safely. Outside of Canada, Phentermine is used very commonly for weight loss, and Topiramate is frequently used off-label for the same purpose. Cost comparison. Generics for Phentermine and Topiramate exist. Even without insurance, the cost is well under $100 per month. With insurance, it could be like $10 to $20 per month. Qsymia is the most expensive, at around a few $100s a month, and is rarely covered by insurance. Which is most effective? Comparing the weight loss effects of Phentermine and Topiramate is not easy, since studies rarely compare them head-to-head, and Topiramate is technically not even a drug approved for weight loss. However, the available research seems to suggest that Phentermine is more effective in the short term, with some people able to lose almost 10% current body weight, but quickly loses efficacy within weeks. As such, Rebound weight gain is much more common upon discontinuing phentermine. Topiramate is less effective in the short term, with people less often losing weight, and when they do, it's usually modest, around 3% current body weight. However, its weight loss effects are continual and sustained even past a year, suggesting its long-term effects on weight loss are better than phentermine. Qsymia combines both, and unsurprisingly is more effective than using either drug individually. In fact, comparison studies with other weight loss drugs like orlistat or Belviq seem to show that Qsymia is one of the more effective weight loss drugs we have on the market to date. Summary: they all help to suppress appetite, so if you find yourself overeating and snacking too often, they may be helpful. Phentermine is best used short term, since its effects on weight, albeit strong, are not sustained, and you will need to have your diet take over as soon as possible. Topiramate is not commonly used by itself for weight loss due to its weaker effects on weight loss, but is frequently used off-label in combination with phentermine. In fact, a commonly used strategy by some weight loss clinics is to start patients on phentermine, and when phentermine stops working, to then add slow-release topiramate like Trokendi XR. This is usually far cheaper for patients to do than starting Qsymia, kind of like a budget DIY Qsymia. It won't be exactly the same as taking Qsymia, however, since the proper dosing and release timings for each component in Qsymia is a little different in the many forms of phentermine and topiramate. Reportedly, however, for many patients, it seems to be good enough. Qsymia is the most effective, but is the costliest solution. Also, if you do try Qsymia first and it doesn't work for you at all, trying phentermine or topiramate individually may not work too well for you either. Regardless, you'll need to check with your doctor to see if any of them are appropriate for you to use. And remember that the drug should not replace the implementation of good dietary and lifestyle habits for losing weight. Let me know in the comments down below if you have any experiences with these drugs. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know who can use the help.